excited to introduce our friend Sarah. So Sarah is here. Sarah manages caregiver programs and care management for the Area Agency on Aging in the Greater Kansas City area. She has more than 15 years experience working with older adults and caregivers in various nonprofit and long-term care settings. And Sarah has a bachelor's degree in communications from Truman State University and a master's in social gerontology from the University of Central Missouri. She and her husband were foster parents for 6 years, adopting their daughter in 2022. Sarah is equally passionate about serving at-risk children and older adults, and especially enjoys intergenerational program development. So Sarah, we welcome you and take it away.
And thank you for letting me talk to you guys about the good work of AAAs or Area Agencies on Aging today. So MARC is the Area Agency on Aging for a 5-county area in Greater Kansas City, so Jackson, Clay, Platte, Ray, and Cass counties. But if you're unfamiliar with the Aging Network, AAAs are everywhere. It's that we receive the Older Americans Act federal funding that comes down to states, and then states disseminate that in combination with their funding to AAAs, which are kind of like hubs of resources and services for older adults and caregivers. And I actually got my career start at a AAA when I was an AmeriCorps volunteer. I was working at Cardinal Ritter Senior Services in St. Louis, and we did the assessments for home delivered meals and different services for the St. Louis Area Agency on Aging. And so I'll never forget kind of having that sort of formative conversation with my station supervisor about like that explanation of what AAAs were and like how they can serve older adults. And it was just kind of really a nice foundation for me and my career from that point forward to understand what these organizations are and what they can do for people. And if I wasn't working directly at a AAA, like I was always able to refer people to their services and have that solid understanding in the work that I do. And so I'm always excited to share that understanding with other professionals so that you can refer people to our services and equip older adults and caregivers to access the resources that they need. You have a AAA in Central Missouri and in Southeast Missouri and in Southwest Missouri and Northeast Missouri. There's one wherever you go, and it's just kind of finding it. And certainly if you need help accessing the name of your organization, I can help you with that, or we can get you to the right place here after this presentation. But I'm going to share with you a little bit about what MARC does, and the services that we provide are really similar to many of the AAAs in Missouri, because we all have funding for certain categories. That being said, different AAAs are going to have the flexibility to develop their own programs, so there is some variation, of course, throughout. But these are some really common core services that you're going to find regardless of who your AAA is in your area. These are some different funding sources that we have. Primarily, though, what we'll be talking about today are the services that we receive funding for through the Older Americans Act. We do have services for veterans with some different funding sources, and from Medicaid for some different services. And then we also at MARC have what's called the Community Support Network, which is focused on partnerships with healthcare entities to develop different services and supports for members of health insurance plans or certain clinics. And so that's kind of like a parallel group of services that we're offering. And it's a model that is being really promoted or kind of publicized throughout the country as a way that area agencies on aging can expand their services and kind of have a different funding stream to reach more people. So through the community support network, we can actually serve folks who are under the age of 60 with some of our services too. So wherever you go, your AAA is going to have home delivered and congregate meals. So home delivered meals are what we think of as meals on wheels, where homebound older adults and people with disabilities can get meals delivered to their door-to-door to their home, sometimes frozen or sometimes hot. And it's a way to kind of check up on them safety-wise, but also to just ensure food security and a friendly visitor for those who are isolated too. And then congregate meals, most all area agencies on aging have senior centers, or they used to be called senior centers. Sometimes they kind of shy away from that term, I think now, maybe if people don't like being called a senior, but so they might be like community centers or like they may have a different name, but they're places where older adults can go and not only get a nutritious meal for lunch, but also have like exercise classes and presentations about health issues or volunteer programs that they can do, just really focused on socialization and health. And that meal is there if they're able to get out of home. And some area agencies on aging provide transportation to those senior centers too. So certainly if you are a kinship provider or an older adult over the age of 60, or you're somebody who has a disability, excuse me, those home delivered meals might be an option if you're homebound. If you're not, then you could certainly take advantage of the community centers to go and be with other older adults or people with disabilities as well. So, and then most area agencies on aging have transportation services. Here at MARC, we partner with Jewish Family Services, and then they kind of subcontract that out to Lyft and sometimes Uber to do rides where they pick the older adult up at their home and take them on like four one-way trips, 2 round trips rides to wherever they want to go. And then we have Lyft Ramp, or like also provide rides if somebody a wheelchair or needs a mobility device. Also at MARC and at other area agencies on aging, you're going to find care management services, and that is basically like an advocate or a social worker who can help older adults or caregivers access community resources, fill out applications, look for housing, understand their health care. I did care management for quite a long time and feel really passionate about that work. There are just so many older adults and caregivers who just don't know how to get the help that they need. And so oftentimes when we do need to go beyond information and referral and help that we provide. So at MARC, we have this central intake line where people will call and then they share what services they're looking for. That comes to us, the area agency on aging, and we then set up with services, and care management being one of those. And if we can simply provide information about a food pantry, for example, or a utility assistance provider, that's great. And some folks only need that connection, and they usually won't make it to MARC to talk to a care manager. They'll usually get their needs met with that one call to our 211 system. But if it's clear on the phone or whatever in the in-person interaction that somebody has multiple needs, persistent needs, complicated needs, chronic health conditions, and it's going to be really hard for them to take advantage of services just with a phone number or a stop into an agency, that's when care management can be really helpful. And so we provide that, of course, free. And most all other agencies on aging are going to have care management as well. So as far as caregivers, caregiver services is my kind of area of expertise, and what's probably going to be relevant for a lot of the folks that you serve, or you as a kinship caregiver. We can serve caregivers of older adults who are over the age of 60. The care recipient has to be over the age of 60. We can serve caregivers of people with dementia, any age. We can serve caregivers who are age 55 plus, of adults with disabilities, age 18 to 59. So that's going to be like those older caregivers who maybe are raising an adult child who has like Down syndrome and is aging, or some other health condition where they're going to still continue to need a lot of support even into their adulthood. And then we can also serve, importantly, this kind of central category of caregivers age 55 plus who are raising children under the age of 18. So that is going to be oftentimes what we used to call grand families, or still called grand families sometimes, or that's going to overlap with the kinship caregivers if they happen to be 55 plus and they're raising children. We can provide services to them. And so most area agencies on aging have some outreach to this category, but I think it's still an area where a lot of us are learning and developing programs. At MARC, we have now sort of informal partnerships with a Northland Grand Families, and it's called the Grandparent Support Network in Kansas City, where they have existing support groups for older caregivers of children, or any caregivers of children that are kinship. And so we can refer people, that category of caregivers, to those organizations for resources and socialization and support. We also do refer people back to ParentLink when they have questions. And then we have a newer program that we started this summer called Grand Pass with, which is a partnership with Foster Adopt Connect, where we could pay for a week of summer camp for the children of older caregivers. And so that was a really cool and new, exciting program for us to do. It wasn't big this first summer. We just worked with the YMCA of Greater Kansas City for their day camps. And they did have about 5 different locations around the metro. So if a caregiver called and they were needing a break, basically they would do a short assessment with us. And then we would send them the registration forms for camp for the Y. They fill out like their preference of which location, and then the Y reached out to them and finished the registration, and on the back end billed MARC for that camp experience. And I think it was really successful. And we had probably about 50 applications, but in the end, 23 actual kiddos that were served, and I think 17 caregivers, because so many of them had kids who were outside the age range of the camp. The camp was ages 5 to 12. And so they would either be like not having done kindergarten yet or not entering kindergarten yet. Or we had quite a few had like 13, 14-year-olds and were looking for camp. Or caregivers might have been under the age of 55. So there were definitely some age barriers to accessing that program that we'll have to tease out. And then also just like we didn't have, we hope to have more camps. So we started with just one to kind of keep it simple. And quite frankly, just to be able to get the paperwork done or the kind of the MOU signed with one was a lot of work. I think it's sometimes hard with Older Americans Act funding for community agencies and organizations to be able to get to comply with all of the requirements. And so we were just excited to have one partner with the YMCA to start, but having access to more camps and different types of camps throughout our region is definitely a goal to make the program more robust in the future. And so that was a really cool program that we could do for that type of caregiver, long story short. We look forward to expanding that too and coming up with some other ways to have respite for kinship caregivers when they happen to be in that over 55 category. And then we also have in the caregiver front, we have programs for those caregivers of people with dementia. We have a program called Care Text, where we can, over a 6-month period with KU's Alzheimer's Disease Research Center, they can send out information and supported resources via text. The purpose being that those caregivers who are busy can access that information at any time on their own terms. And then if they want to learn more, like they are like, oh, I'm having this difficult behavior with mom or dad or whoever, they can click on keywords or type in keywords on the text, and it will actually take them then to a caregiver coach at the ADRC to talk through that specific issue. That's a newer program that we're excited about and kind of still learning on about the outcomes on. And then through that program, through that partnership with KU, we also offer the training room, which is like sort of a one-stop science fair style event where caregivers can go and get little 15-minute information segments about different dementia-related topics. And then we have both structured respite and in-home respite. So we provide respite through contracted home care agencies for caregivers. So that's going to be a common thread at most area agencies on aging. Wherever you go, they're hopefully going to have in-home services to kind of relieve that caregiver, give them a break. And those people can help with, those caregivers can help with like light housekeeping, meal prep, errands, sometimes just companionship supervision as well. For a set number of hours. So we offer that. And then we have also something called the Break Time Club, which is where caregivers can go and drop off their loved one at specific sites, in our case, shepherd centers. There's structured activities and usually a meal for the care recipient or the older adult, and then the caregiver can go have a little relief and get done what they need to for the day. We call that the Break Time Club, but there's different names for that. And other area agencies on aging also often what that looks like is a partnership with an adult daycare. So that may be available. And then we at MARC certainly have funding to develop new caregiver initiatives and supports and services. So that may be the case at yours too. If you are somebody out there who's thinking like, why don't we have this? Or I'd love to see this. I think you should always feel free to meet with your area agency on aging and express the need or network about possibilities, because oftentimes there is available Title III funding to do new things for caregivers. We also have a home modifications and repairs program at MARC, where we can do both small and some larger repairs to support aging in place. That might look like putting grab bars in, or fixing a leaky faucet, or building a wheelchair ramp, things like that. We contract with different nonprofit providers in the area to do that work. Some area agencies on aging have home mods and repairs, some don't. But it's certainly a growing area as well because it's greatly needed. I think it's a common thread when we talk to caregivers and older adults that they just, in order to stay to age where they live and stay in their homes, they need these things done, which can be expensive and can prohibit them from being able to stay in the least restrictive environment. We already kind of talked about the in-home services we have. Those are, we sometimes call it respite if we're relieving a caregiver or informal family caregiver, but we can also provide those same services in the home through home care agencies for just older adults, even if they don't have an existing caregiver in place. And we do have a small consumer directed option where, just like with Medicaid, if you're familiar, caregivers who want to appoint a family member or a friend to be their caregiver and be paid by MARC, we also have that option, which is a little bit newer. And in that case, they do need to be able to kind of self-direct. So it has to be a caregiver who doesn't have like dementia or some type of significant mental health issue that would impair them from sort of assuming like an employer role over the person that they hire to be their caregiver. We also offer legal services. So I know you guys were talking about those legal clinics, which are awesome. We have a contract with Legal Aid of Western to do things like durable powers of attorney, elder law kinds of tasks, but they can also assist with public benefits access issues, tax kinds of things, and like unfair evictions or some housing matters as well. They do have resources to help with guardianship, which I know comes up again and again for kinship caregivers. And so when we come across those needs, we send them to legal aid and they're able to help with that. I know that is just an area though of opportunity for sure, that sometimes people can't access the legal aid services because they do some of their own screening on just income and availability of attorneys. So I think that's something that we could definitely do more of, and I'd be interested to hear kind of around the state what other area agencies on aging are doing as far as volume of guardianships for older caregivers of children and what that looks like. So just in terms of like eligibility for our services and what the process looks like, I touched on that a little bit, and it may look different where you live, but we have all of our initial calls generally are fielded by United Way 211, and we have dedicated aging specialists there who take those calls, screen for the need and eligibility. So most of our services are age 60 and up, or a caregiver of someone age 60 and up. But as I mentioned before, we can also serve people who are 55 and up if they fall into those specific caregiver categories of people with children. And then for home delivered meals and transportation, there's some availability to serve people who are under the age of 60 and have disabilities. But that's kind of the point of having United Way, is that they'll go through and check all those boxes for age criteria. We do get income just to kind of determine whether someone is Medicaid eligible for some of our services, because we might steer them in that direction, but we don't have any like, you have to make this much to get our services or this little to make our services. We can't really means test through the older. So generally speaking, we don't have financial guidelines for services, but those calls are fielded by United Way. And then depending on what services they need, it's transfer. If it's beyond information and referral, it comes to MARC, and the specific staff person then follows up with that caller and plugs them into the needed services. And in general at MARC, we contract out the majority of our service provision. So we then are partnering with different community providers to, for example, with Jewish Family Services and Kansas City Cares and Shepherd Center to offer those care management services. So there's kind of a multi-step process to get people to the actual person who's going to come visit them or actually provide the services. So that tells you a little bit about our process and how to access our services in general. At MARC, we have some other programs like Double Up Food Bucks that helps participants who have food stamps to be able to use those as vouchers at farmers markets in the area and other food stands. That may be a little bit unique to an area agency on aging, but a cool program nonetheless, and something that we can connect care management clients to when we're working with them if we identify a food need as well. And then most AAAs have the long-term care ombudsman program, which is impartial advocates for older adults who are in long-term care facilities. They can make sure that those residents understand their rights. And if they have complaints or concerns about the quality of care, an ombudsman is just that advocate person to kind of help them resolve that issue, whatever it might be, and then kind of bring awareness to some of the concerns that exist in those types of facilities as well. We have the Veterans Directed Care program at MARC, which is funded through the VA. It's kind of separate, and it allows vets who can self-direct their care, who are competent to make their own decisions still, to hire a person in their a family member or a friend or even an agency to be their caregiver, and the VA will pay for it. And we pair them with like a care manager or a social worker who's kind of processes the payment piece of it or helps them understand the financial aspects of that, but then also is their advocate for resources and services too. And then we have a whole host of evidence-based programs or workshops, which are health and wellness classes, sometimes with a social component, that are free and accessible to adults and caregivers. And we can provide you with that website if you're interested. That's actually, those classes are available to people all around the state. A lot of them are virtual, but there are classes like chronic disease self-management, Walk with Ease. For caregivers, there's Building Better Caregivers or Aging Mastery Program for caregivers, but they're all free, typically evidence-based health and wellness workshops. So that's a really cool part of what we do too. And that's a similar thread at area agencies on aging throughout the state.
The Missouri area Agencies on Aging map, where you can see it's color coded and you can see what area agency on aging is in your region of the state. So there are 10 located throughout the state, and this map will not only tell you what area agency on aging is in your part of the state, but will also give you the website and phone numbers for the area agency on aging in your part of the state. So you can find that information here and then just reach out to them directly through the phone number or through their website.
All right. Well, again, Sarah, thank you so much. And again, all of you, thank you so much for joining us today.